So in this video, we're going to talk about expectations at the 6-week post total hip replacement stage. So one of the things I like to tell patients is you're not done healing yet, right? If you've broken your ankle or sprained your ankle in the past, you know that at 6 weeks, we take you out of the cast, you finally start walking. Everyone knows that the next day your ankle is not normal, it's not perfect yet. It takes time. The same thing with the hip replacement. Over the last 6 weeks, your body has done a lot of healing, but it's not done yet. The scar is still kind of thick, and now your body has to chew all that extra scar up and lay it down until it's like this. That's a chemical process, so it's going to give off heat, so it's going to be warm to touch. It's still going to be swollen because those chemicals have a magnetic affinity for water. They pull water right out of the blood vessels, right into your hip. So it makes it feel tight and swollen and warm to touch. So that's all very common, very normal. Because of that, if you sit for 25 or 30 minutes and you go to get up, that first couple steps will be really limpy-gimpy, I call it, right? Where patients, they're just uncomfortable for about 5 steps, maybe 10. That's a normal finding at 6 weeks. There are a few patients who tell me they don't have that at 6 weeks. I don't know, they're lucky, I guess. The rest of us at 6 weeks have a little bit of discomfort the first 5 or 10 steps. Most patients are off the walker, and many patients are off the cane, but you may still need the cane, particularly in upstate New York in January and February. You may want to hold on to that cane a little longer so that you don't have a fall and create a new injury. Many patients are fatigued because blood count is low, and that low blood count lasts for 9 to 12 weeks, and so you may also still be a little down in the dumps. You may still need mid-afternoon naps. I mean, these are things that are common for most patients. Speaking of napping, I get it, sleeping is tough, really tough. The Academy says about 12 weeks for it to come back to normal. My patients, generally between 6 and 8 weeks, things start to turn around. I think, to be fair, it's if you really let that soft tissue calm down that first 6 or 8 weeks, it's easier to sleep. You've got less swelling. If you decided to try to really do a lot and you've still got a lot of swelling, again, maybe you need to back off a little bit. Driving, many patients are considering returning to driving. You can't take any narcotics and drive. That's a no-no. You go to jail for that. And again, you have to have good leg control. So if you don't think you can keep yourself safe and everyone else safe, no driving yet. But again, many patients have gotten to that point. So again, a range, a bell curve. I want to remind you that for any dental work, you need some antibiotics. There's a small risk you could get an infection when they clean your teeth, scrape the gums. The bacteria in your mouth could go to your new hip. So for the first 2 years, I want you to take an antibiotic about 1 hour prior to your procedure. It's generally 4 tablets. And so what we'll do is we will prescribe that for you here in the office at the 6-week visit. We'll send it right over to your pharmacy so you can pick it up, put it on your shelf, and it's all taken care of. For certain, I want to see this hip when it's 1 year old for an x-ray checkup. Obviously, if there's a problem between now and then, I want you to contact me, let me know what the issues are so we can get you back in and address it. But on the other hand, I've had many patients who would come at 3 or 4 months post-op and say, "Doc, I don't know why I'm here," and paying a copay. So I want you to keep your money in your pocket unless you need me. If there's any questions, feel free to call, and we will be touching base soon at your 6-week visit.